All right. So good afternoon, everyone. My name is Stacy Perlin. I'm the chairperson of the Perlin Foundation for Wellbeing. I want to thank you for joining the presentation this afternoon. Let us begin with a land acknowledgement. In the spirit of respect, reciprocity, and truth, we honor and acknowledge Mokintis and the traditional Treaty 7 territory and oral practices of the Blackfoot Confederacy, Siksika, Kainai, Kani, as well as the Yakse Nakota and Tsuut'ina nations. We acknowledge that this territory is home to the Métis Nation of Alberta, Region 3, within the historical Northwest Métis homeland. Finally, we acknowledge all nations, Indigenous and non, who live, work, and play on this land, and who honor and celebrate this territory. So the agenda for the following hours is as follows. We have, let's get that moving forward. There we go. All right, so we have housekeeping opening up here about the foundation and festival program, about the town hall and our keynote speaker. We have how to prepare for the upcoming question rounds and for the town hall, a section of time for some questions and answers as appropriate, announcements from our partners, and then we'll wrap the webinar up. Our Zoom host for today's webinar is Alberta Social Innovation Connect, or ABSI Connect. They have graciously donated their capabilities as well as helped to promote the event. We are grateful for their support and partnership. Last item for housekeeping, if you have any questions, please enter them into the chat box. We will review them to provide answers near the end of our time together. And so we begin. So I'm going to stop sharing this and I'm going to jump into our other presentation piece. The Perlin Foundation for Wellbeing builds compassion, empathy, and understanding for the mental health, mental wellness, and mental illness ecosystem through our research and projects. We understand the value in healing and that pain is inherent in our life experience. We feel that there are gaps in the mental health conversation and that using arts and culture to facilitate research and improved social collateral will help to address them. Essentially, we use arts and culture to reduce the stigma and improve our societal approach to mental health, mental wellness, and those affected by mental illness. We aim to further our understanding of energy, of emotion, and to improve the vocabulary around the human experience. Crafting these dynamic and resilient solutions will mean an improvement in how we communicate or even approach social work, social sciences, as well as medical science. In order to launch a week-long celebration of mental health, mental wellness, and mental illness, or those affected by mental illness, we need to develop a few aspects first. Number one, attendees who would go to this kind of event as a form of entertainment and emotional fulfillment. Programs that translate research, art, and science into meaningful smaller bites for attendees. And number three, partners who can leverage this infrastructure to benefit their operational and fundraising needs. By gathering Calgarians together over 3 days each year, we nurture these conversations and strategies to successfully launch this festival program in Calgary between 2025 and 2027. But first, we must discover our community in order to learn how best to grow our community and then build our community for the long term. In order to understand the individual, the various communities, and the ecosystem as a whole, we are facilitating a series of conversations. We host our first major event, a virtual mental health town hall, on Thursday, 19th of November, 2020, from 11 a.m. to 1 p.m. This event connects the community to showcase work, share knowledge, and discover new partnerships that can move us forward. Our keynote speaker is Nancy Mannix, patron and chair of the Alberta Family Wellness Initiative, or AFWI, who will speak to work being done in Alberta by her foundation. We will then work with the Design Lab from Alberta Health Services, D4AHS, to expertly gather information through design thinking sessions for us to disseminate into a report. This final document will be designed and sent to attendees, ensuring that their meaningful contributions are communicated to those that need it. The next step in our discovery phase is to engage in regular events and to host quarterly conversations to get to know Calgarians throughout the year. They are meant to assist with developing resilience as a community, one in which we face life and its trials as a collective and learn the necessary information to become more durable, to choose our own adventure with confidence. Our first salon-style event happens in 2021. We will focus on a timely topic connecting arts, culture, mental health, mental wellness, and mental illness issues with everyday Calgarians. In this way, we can start to grow our community within the discovery phase of our foundation's development. In late 2021, we will launch a multi-day, adventure-driven, immersive event to initiate the development of an annual festival program within the city of Calgary. The narrative journey in this designed interpretive center or expo-style environment is through a curated maze of dynamic and static art installations, workshops, presentations, and more using a combination of live performance and digital mediums. Through this crafted pilgrimage, we invite attendees into an engaged, controlled, emotional, and sensory experience. In order to successfully execute this operation, we need to be capable of doing good work, gather those willing to do the work, and commit to ongoing evolution of our best practices. With that in mind, our due diligence regarding governance and compliance has been a priority for the board. The festival and event projects, as well as the mandate for the foundation, are based on research, science, and narratives proven through years of study and practice. Our board works diligently to ensure that we plan, design, execute, and monitor our work in order to reinforce the needs of the organization. We are a group of working professionals, business owners, parents, and advocates. A quick summary of those involved. With over 20 years supporting not-for-profit organizations and business development, Stacy Perlin provides overall organization stewardship. Knowledge stewardship is supported by Yamile Jaswai, a trained clinical psychologist or a research coordinator with a background in clinical psychology with a master's in neuroscience, as we set overall foundation pathways and objectives. Our governance and legal aspects are handled by Eric Perlin and Travis Finlayson, bringing a combined 25 years of occupational health and safety, process and protocol development, and governance management. With a combined 30 years in global project execution in industry, Dolapo Bamboye and Allah Al-Azawi are leading our project planning and program execution. Stephanie Steele supports the team with her administrative professionalism, and Aruj Rashid is a University of Calgary medical student bringing 5 years of volunteer coordination to the foundation to help coordinate our invaluable volunteers and lead the youth-focused development. Marketing efforts are led by Stacy and supported by Josh Blair, utilizing their combined 25 years designing content and strategy. Finally, we have Shazaib Rashid, a CPA candidate, who supports our grant applications and financial activities, helping us set up systems to ensure we operate efficiently. Currently, we operate solely on volunteers as we process our applications for startup funds. While we complete these processes, our pursuit of funding seeks to meet the cost of each endeavor as it is presented. For example, those involved in the preparatory webinar and town hall are volunteering their time and energy as well. This has been a humbling experience, especially as we operate in such a crisis-fueled environment. This brings us to festival program development. The festival program is an opportunity for us to introduce these solutions to the community and individuals so that both may benefit from the endeavor. The idea here being that an individual attends an event and feels an immediate positive impact on their sense of self, while the services community integrates into the narrative so that their services are positioned in a meaningful way. These solutions have the great potential to positively impact the not-for-profit industry in an economic and cultural way. In order for us to set up for success, we start with established theory, prove with practice and experience, and promote meaningful innovation. We have started with established pillars of work within the community. The Hotchkiss Brain Institute has been supporting us since early 2019. Their work since 2012 at the University of Calgary to advance early identification, treatment, and prevention of mental disorders has been quite successful. As well, the work being carried on by the Alberta Family Wellness Initiative to develop and promote the brain story since its origination in 2004 is a key asset in international conversations focused on policy improvement. The Canadian Mental Health Association, or CMHA for the Calgary region, is an organization that has worked for more than 65 years to provide a person and family-centered integrative service model. That's been a phenomenal resource for us. Through our partnerships for learning and development, we are able to consistently improve our access to and understanding of the science around mental health, mental wellness, and mental illness. Authority, in our case, started with those who work in life-threatening or life-saving scenarios quite regularly. The City of Calgary, Alberta Health Services, and Calgary Police Services personnel helped us learn about relevant standards and protocols, experience the current education programs, and gain a sense of what Calgarians need to follow, like what rules we need to follow to be good neighbors and citizens of Calgary. We have been learning about Indigenous issues in an effort to support reconciliation, issues that affect those suffering long-term poverty, and the role of mental illness in recovery and critical service programs. We intend these conversations to be ongoing as they enable us to be aware and highlight some research or initiatives for the public during each event. Leaders can be found everywhere, even in those not holding positions of authority. Leadership here infers a level of authority within their industry or on their mastered topic. These individuals and organizations spend time, money, and effort to establish these studies that make up the ground floor of our festival program. Which brings us to our innovators, recognized authorities or leaders who have applied their mastery into a new evolution of their craft, their science, or their understanding of the brain, emotion, and cognition systems. These vanguards have opened up conversations that stimulate change on a global level, improving the lives of many. Our work culminates in launching a festival program in Calgary, improving the mental health, mental wellness, and mental illness ecosystem, as well as mental health literacy, or also known as mental health literacy, and then steadily expanding that support to serve the world. In a phase 1 draft report for Mental Health Literacy Project by the Canadian Alliance on Mental Illness and Mental Health from May 2007, mental health literacy could be more broadly defined as the range of cognitive and social skills and capacities that support mental health promotion. This includes the capacity to act on social as well as individual determinants of mental health and mental illness. An expanded definition could serve as the basis for a comprehensive population health model for enhancing mental health literacy at all levels. Investing time and energy into these programs is a meaningful contribution to the city's economy, to the Calgary Arts Development's art-led city building strategy, and they work on multiple levels. These solutions toward our current epidemics of loneliness, isolation, chronic pain, depression, and anxiety are not short-term band-aids. We host workshops that integrate 18 and above and 16 and above aged attendees, are accessible in person or virtually, normalize those affected by mental illness, and help people see themselves and their neighbors with more compassion. Next year, we launch a walkthrough of the narrative journey. While it may be virtual due to COVID-19 pressures on public health, it will cover the emotional and designed environmental elements of our program. We are working with our advisors to continue strategic planning for fall 2021. The next phase of our multi-day festival program will be planning, execution, and monitoring a prototype of the multi-storied structure, using this stage of development to test out design ideas for transferability and durability. We will also be integrating more technology into the structure for ease of transportation and access during the event. We will be maxing our attendance numbers at this time using our planned location, so we'll likely be shifting to our new planned home for the 2023 edition. We then build the festival around the prototype, letting the codes of conduct within the narrative experience ripple throughout the grounds. What is typically associated with festivals? Maybe it's the extended food truck garden, stands and displays to get to know local vendors and service providers, and local entertainment to help us celebrate. This encourages each guest to truly make a day of the festival and the city to make the most from the social and economic opportunities of the multi-day event. Ultimately, this pop-up interpretive center that works like an expo for mental health, mental wellness, and mental illness, and those affected by mental illness, will be able to travel to cities across Canada, growing through their arts and culture communities to serve the rest of their city, enhancing mental health literacy at all levels. So that brings us to a wrap on our big story. We are committed to a collaborative approach, as we know that we cannot do this successfully without our community, our volunteers, and our own self-awareness. Our partners help us to provide meaningful community to our value to our community. They help us communicate science that progresses us as an empathetic society and celebrate knowledge and learning in ways that we can truly appreciate. Sometimes they act as partners in our business development, our promotional partners through sponsorship agreements, or even work as knowledge and content sharing peers. Our community is enriched and nurtured from their involvement. Currently, we're focused on covering operational expenses as we build our capacity. We typically forge partnerships to access science, authority, leadership, or innovators so that we may promote their work to those that might directly benefit in the community. Tiers of agreements are community agreements, in which you or your organization promotes us and we promote you. Operational agreements, in which you or your organization contributes directly to an aspect of the festival program. And sponsorship agreements, in which your organization wants to improve financial accessibility, such as subsidizing tickets for vulnerable youth, or enabling an authority to present, or wanting to share their service with the public. So I really appreciate us taking the time together to talk a bit more about the Perlin Foundation for Wellbeing. And we're going to get back into our talk here about the preparation here for the town hall. So let's take that one down here, stop sharing. And let's head back to on camera. Okay, hi guys, thanks for listening so far. Appreciate you taking the time to listen to that piece. So as I mentioned, in order to understand the individual, the various communities, and the ecosystem as a whole, we are facilitating that series of conversations. So we begin with today's webinar, and our second event is the town hall. Our keynote speaker is Nancy Mannix. She's going to be setting the tone for the work to be done. As the patron and chair of Alberta Family Wellness Initiative, she has spent years translating complex science into meaningful data that affects change. She will speak to their research, their partnerships, and the impact of AFI's work being done in the field. This is not a comprehensive review of work that's going to be done, as that is what we're working to capture. We'll be working with the Design Lab, as I mentioned, from Alberta Health Services, and they're actually going to be using the designed, those timed sessions in order to gather the information. They will be facilitating each of the breakout groups in order to really capture the information that can be used in order to let's get into some of the questions here, actually, and that'll help us get a sense of how those design thinking sessions will add up into a report here at the end. All right, so back to screen sharing here. Let's head back over here and let's break it down with how to, let's break that in. There we go. All right, so how to prepare for the design thinking sessions. Hopefully we will not have to dress up like this because we'll be all happily in our own rooms. But let's take a look at the conversation. So the first round is going to be talking about who are we. So this is going to include information on, well, what normally comes to mind when we say, well, who are you? We think of the organizations that we work for. We think of the leadership, the people that we aspire to or that herald the organization. And we think of the programs that define operations for the organization. And so we'll typically use those three pieces to initially answer that question. However, we also will find people coming up with, oh, but we need this, or oh, but if we're going to work with that. So we want to make a bit of space to capture a few of the barriers, not going into too much depth. And what we're also going to work to do during this session is to identify the control between the relationship of the individual to the work that we're talking about to the organization that they're going to be talking about as well. And hopefully that makes sense. So the point here is that for this first round, we're going to be talking about identities and how we identify what we want to categorize. Now for the second round, we're going to be talking about what do we really need to do good work. And the conversation here, the themes that we're going to be talking about is information on requirements. What do you as an organization need to help the people that you want to help as far as information on requirements? Well, we need a referral, or we need to know certain pieces of information. Policies, well, maybe there's a policy that is in place that's instrumental to the work that you do. You know, like we have outreach programs within AHS, but if we didn't have these types of policies, we just couldn't do the work. So the funding pieces that we rely on, the people that we rely on, as well as challenges that we rely on, and attitudes. Now, let me get back into challenges that we rely on, because oftentimes we think of, okay, we got to get up and go to work. It's not something that we bound out of bed to do. But if we first start a project or a job, we're often going, I want to get up and help. I want to get up and make a difference. So those challenges that you're ready to jump up and face, often we forget, because we think, oh, we've just motivated ourselves. We just had a really good song on the radio. But I feel like there's some really great opportunities for us to talk about the reasons why we go to work and the reasons why we do the work that we do, as part of some of the information for what people require in order to really do that good work. The third round is, who are we helping? And so that's where we're going to focus the conversation from those that are in the information sessions and those that are in direct relation to that conversation, to who's using the services, who's accessing the information that you're giving out, and who's benefiting from those services, as well as who's getting turned away. And I feel like that conversation for the groups is really going to focus on, yes, the service group, but since we've cleared off some of the attitudes and the challenges, we're really able to focus specifically on who is getting the biggest benefits from the work that you're doing. Our fourth round, how else can we do it? So this is where we're going to talk differently about how we work. And it's a bit compressed at 15 minutes, so we get a bit shorter again, but that's on purpose, because what we're going to do is, within the groups, since we've been able to offload some of those prejudices or biases, and once we've been able to really talk about the work that we want to do and get to do, then we start to think differently. Okay, well, is there a better way? Or what do we feel could define a better way for us? What measurements, what KPIs could we be looking for? So we'd be looking at information on how we might move differently as an ecosystem. So this conversation, again, is we're going to be motivating the attendees to a place where we have a perspective that's higher than we typically sit, right? Typically, we get to work and we're focused at what's in front of us, at the people that are in front of us, and how we got to do the work in front of us. And this town hall works really hard in order to get you out of that perspective and to lift you up, so that you're able to look over the ecosystem and go, okay, so in this range of people that work for profit, that work a nonprofit, that are public and private, people that are service oriented, but people that are more software oriented, but all still facilitating mental health from a societal perspective, it really helps us to think differently about what work we can do and how we can do that differently. So within those operations, as well as how we engage with those benefiting from the services. Maybe there's a different way that comes up in these conversations. All right, so that brings us to our last facilitated round. So we're going to be talking about how we perceive our competitors and our allies, because this allows us to talk about solutions. And what we're doing is we're talking about solutions that acknowledge how organizations and individuals feel about their agreements, perceived barriers, the community, and the partnerships, and how authentic the relationships are in the context of the work being done. Because the design lab is really amped up and going, okay, guys, we don't worry about the hows. We tend to cut ourselves off, or to limit ourselves based on, well, I don't know how that's going to work, and I can't figure that out right now. The thing is that if we focus on the what's, we're going to come up with as many potential solutions as possible, so that we can let everybody know these are the kinds of solutions that we want to work towards, which gives us the most opportunity for follow-up conversations afterwards. And that's why we have not only facilitators during these design thinking sessions, but also mediators to capture that information. Because what we're going to do after that, after those 5th sessions, is gathering that information together so that we can facilitate the conversation, go, okay, so in order for us to do good work, how are we going to be able to use this information on the individual level as well as at organizational level? And so I have a couple of pieces here just to jump back. I know I've been talking for a bit, but I do want to jump back to how we can best prepare for the town hall coming up here on November the 19th. And then I'm going to open us up for questions and answers from those attending, just in case we have some conversation about what can be generated from this type of a conversation. So what Nancy Mannix is going to be talking about for the keynote presentation is some really inspiring pieces about not only what work has been done on the brain story to date. So for example, we're going to be talking about the research that's been done, the certification story, how that's been expressed or executed across the province and then across the country, but as well how the science is starting to be used in everyday scenarios, so that she's actually got a couple of case studies that she's going to show to give examples of the power of taking complex science and breaking it down into meaningful chunks for people to easily digest, again, in a fun and adventure-filled environment. We want to make learning fun for everybody, right? So the challenge here is, because we are starting with such an advanced group with this town hall, the majority of people that are attending have actually already been certified through the Brain Story certification project. So at the end of our work here, I will be putting up that link so that everybody can follow up on that. One of the requirements for the town hall will be to initialize, do some research, and to actually check out that Brain Story. If they can complete the certification beforehand, if they haven't already, all the better to us. The conversation we're actually going to be having is going to be quite in depth, talking about how that brain function already works and how we can integrate it into more meaningful operations. And what I mean from that is there's going to be announcements from Nancy about how the City of Calgary and the province have started to integrate brain story education into frontline services and into essential services within the community. So it helps motivate attendees to get a sense that the work that we're doing, the conversations we're talking about, are going to be introduced into our children's lives directly, into our lives on an ongoing basis as part of our civic responsibility and engagement regularly with the municipalities. So for us to be best prepared for this work that's already happening and to be able to jump into these opportunities that are being presented, it behooves us to be educated when we show up to do the work on the 19th. So I think that covers the most of the stuff that I wanted to get out as far as the must-haves and how to prepare for the conversation. I do want to open up the floor to questions and any curiosities that you guys have to bring to the table.
Thank you for the presentation, Stacy.
Thank you, Dolapo. I appreciate that. I was going to say, did you guys have any questions? Anything that seemed out of the, I know I just got off the phone with Nancy just before the presentation today, so I know I was at least able to give a bit more information on what she's going to be talking about and how we can frame that to really get some information that can be a fabulous opportunity for an annual report to Calgarians, just acknowledging the state of the community and being able to then move forward with a reference point. I was gonna say, I know I can see Eiley thinking away. She's got so much work already in the go, and I'm like, you have such a wealth of information. I can't wait to hear from you.
Thank you. I'm so sorry. I had a phone call about my project right as you began your presentation, so I wasn't at the beginning of it. But just my curiosity is, Zoom has now new capacities within it that you can do breakout sessions within Zoom, and I'm just curious if you're going to use any of those or like innovative ways of meeting online to engage conversation in your process.
Really great question. I actually really liked the infrastructure that you used in open spaces at C-Space a couple of weekends ago. I was just floored by the level of engagement that you guys were able to get in such a geographic space translated into a technical experience. Really fascinating. And I think that that infrastructure worked well, especially for the work that you were doing. Yeah. So I know that Josh is going to be meeting with his design lab team to come up with some recommendations for some different infrastructure pieces, such as the software you were using, but I'm going to be checking in with everybody to go, okay, well, I know Zoom has the basic capability to do breakouts, and we'll work based off of that base expectation. But I think if we can learn, if there is an opportunity to use something that will work better, I think that would be great. Right now, I'm trying to focus on finding the right people to drive the biological aspects of the conversation, hoping that as we get towards the dates and as we get to a place, like for example, even 2021's walkthrough, what's the technology that's going to make sense for that to be delivered safely to Calgarians? Is it going to be a 3D model that we end up doing virtual reality walkthroughs, or is it something that we create a narrative video for people to play through wherever they are? we don't know yet, but we know that if we have the right people and the right science in place, we'll have a much better chance of creating the meaningful solutions. Mm-hmm.
How many people are you hoping for this town hall?
So for the town hall, we're hoping to get anywhere between 125. So that's including the approximately a couple hundred different organizations that across Alberta have already been through the Brain Story certification piece. And then what we've done is we've taken that core group, and then I've added on from the for-profit side. So from that social enterprise perspective, I've reached out to about a dozen different companies and startups in Calgary that are focused on mental health, as there's like 2 million apps for mental health and not many are actually working to improve it. So, you know, there's definitely a conversation that we want to have. And then what I've also done is reached out to each of the different healing lodges, because I found that they weren't represented as proportionately to the other groups. So finding different other, as many different groups, whether it's with the Immigration Society as well, finding those types of communities where people have not necessarily been invited to the table previously, because what we're doing is we're taking mental health as what would have been an aspect of their services and creating more of a highlight as an offering from them. So they wouldn't even be considering the work that they do in mental health as part of their direct mandate, because they're trying to help people either find work or find safety or find sanctuary. And while mental health is an aspect of that ongoing piece at all levels, to be able to draw that out into its own heading, like that's why I'm trying to give us at least a couple of years to go, okay, well, how are we going to be able to get those conversations from people? So for example, I see an organization like Keys to Recovery here in Calgary who would have really gone through a tough time right now, because again, it's about homelessness and stability in a time when people are really unstable with their homes and access to, and to be able to go, okay, well, can we find an awareness project piece between, like, for example, let's say they're having an issue doing their applications for funding and stuff. Well, our compatibility or competitiveness is actually a reflection of our collaborativeness, and being able to come up with better ways of dialing into each other. We're better able to support the ecosystem as a whole. And I know that it's from what I've learned over the past couple of years of conversations is that I think like anybody who has looks at themselves, they have a hard time seeing themselves as the way others do, right? And so we're like, okay, I do this is what I do, I go to work and I'm fine. And somebody else comes up to you and you go, man, you know, you really have a superpower in mental health. You really have an opportunity to speak when people are in crisis or in need, and to make a change for the better. Because what's inherent in these experiences is trauma and pain. And even just to change that conversation from saying, you know, we realize that you deal with a lot of inherent trauma, we go, hey, we realize that you guys are in a fabulous environment to introduce some brain concepts that can help people stop blaming themselves for their challenges, and to start working with what they can work with in order to improve their success with attracting those solutions that make sense for them.
Hi, Stacy. Thanks.
Hey, Millie.
Hi. I wanted to ask, it's for the town hall, not only should we ask the what, but we should also ask the how. Because if we're focusing on the community, it's the community that will most likely be more engaged if they also come up with their own solutions and their own strategies. And that can also be a community building strategy. They're all working together for a common goal. And regarding the story, considering how multicultural Canada is, we might want to consider or think about how each person from all the different cultural backgrounds might see that as. And how to put it in a way that they can all feel included. Because I can imagine that Native Americans will feel their story different as someone from China or Iran or Europe or Latin America. Exactly. So how can we include that cultural aspect? Yeah, exactly.
Well, and it sounds like an opportunity to identify those lenses in its own own conversation. Like maybe that would be something that we could look to in February for that piece then, and then focusing that February conversation on identifying and further exploring those lenses, the lenses with which we view. Okay.
And then to take Yamele's conversation point a step further, even breaking down like those hows into their subcategories, right? Because we get those overarching solutions that are really, really grand goals. And if you're talking to groups that are facing multi-dynamic situations that include safety, security, and like their physical well-being, like those might be a lot harder to achieve those solutions and goals if we don't also find ways to include that into their solution set and break things down in a gentle way where they can start to, it's kind of like being fed from a garden hose at that point, right? So it's like, how do we slow down the flow of information in a way that in a high trauma situation, they start to, in small bites, get that information within
in a meaningful way. Yeah. So I think that's a really good point, Stephanie, because, and Elise and I were talking from Absi Connect, because she, again, has that design background and she's worked on reports, and we're going, well, how would you create a report from the material that we're generating? And then how would we want to express those pieces in a way that, like you say, is going to be the biggest impact to realistically setting the tone? Because we want this to be an annual conversation. And we want to be able to go, like you say, if we've broken it down into those different areas, we can say, well, we know that we expected these ones to really make some changes within the last 12 months. These other ones we know are going to take a few more years in order to see some movement forward.
And for that, it would be really important to engage with people from the community, and they help generate those reports, because they will most likely know how they would maybe perceive or understand the information more than we would.
Very much so, yeah. And I think that's one of the reasons why Nancy was so keen to be part of the conversation at this level, was because that's the stuff that she will get most excited about and talk about, because again, it's the conversations, we're not reinventing the wheel. We're taking the good work that's being done, the work that we know works and what we need to do, and bringing it out to a conversation where, like you say, we're talking to people, where we're breaking it down so it's easier to understand, or introducing it in, or learning enough about our other communities in order to better translate the information so that it can be communicated in better ways.
Yeah, absolutely. And right off the top, as you were mentioning earlier in the presentation about having some really well-rounded, educated people at the town hall, it kind of reflects on the poverty gaps that physically exist. And I think one of the concerns that I can see right from the onset is that we have this mental wellness gap where it's like, yes, we have all of these educated people, but it's, again, really remembering that our focus is essentially for the people that don't have that foundation and mental well-being, that need that help and support, right? Like, how are we taking our education in that way that we've achieved it and using it to help other, like the people that don't have that, regardless of age or community, right? Like just really remembering that this is the point of the whole conversation.
Absolutely, Stephanie. I mean, you're right, because in my mind, I've still got the people walking through that festival in my mind all the time. Whenever we're having a conversation, it's like, well, at the end of the day, for those that fall through the gaps, whether it's, between ages 17 to 26, from a health perspective, or even just a civic perspective or a financial perspective, those years are tumultuous for anyone. And to have the wherewithal to understand what you're looking for, to assess yourself for normal mental health, can be a bit much. And especially in a place where we haven't necessarily had that education from the get-go in our systems, right? So yeah, there's some really neat opportunities, but like you say, we have to bring it back down to This is supposed to be a festival where people can attend, and if they need help, they will be able to find it very quickly. If they assume that everything has been fine and they've never had an issue, they will quickly learn that it's okay that they definitely have had some issues in the past. In a healthy way to gently check people's awarenesses and to be able to challenge their assumptions. So, I mean, one of the pieces I've talked about in the past for what I think would be a personal victory would be for a child who has had a parent who has had to ask for help every step of the way, but every time they've asked for help, whether it's been through a social service or a health service, there's been inherent trauma at every interaction, which is not unlike what we've seen in today's society. And those kids will have a much harder time asking for help, never mind getting the help they need, because of that experience and because of that upbringing. And if we can just show one example where we can validate the parents' work to support that child, where we can validate the help is there to meaningfully help within a context that is not harming, I think would be a huge victory, even just in one person's individual experience. Anyway, I digressed.
No, and I just really like that concept that we're working towards closing the gaps that people consistently fall through in the system. And I like that as a major keynote of the work that's going on.
Not only that, but we also need to validate their experience, and that while it is okay that they feel frustrated, that they feel angry towards the system that maybe they perceive that let them down. So it's both those things, and we need to also convey that yes, their feelings are absolutely valid and understandable.
Oh yeah, and to take those feelings as a driving factor in that development. I think that's one of the biggest pieces, even just in the work that we've been doing, working with social enterprises who are going, oh no, mental health, you're tracking attendance. It's like, no, we're tracking feelings, guys. I know it's health, but it's feelings, and emotion is how we determine our health. Just like you're looking for bruises on the skin, it's a bruise of a different kind. This has been such a wonderful conversation. I am grateful, so grateful that you guys have been so engaged in this conversation. Is there any other pieces that we'd like to throw into here because I know that we're going to be taking this recording and throwing it as far and wide as we can as well. So any things that we want to put into the community so that we can encourage conversation on the 19th of November?
I'd really like to add something if that's all right. I'm not sure if you're familiar with Johann Hari's work and his book Lost Connections, but I read that book and I was deeply moved and brought into awareness that our epidemic of loneliness is really deeply connected to how our communities are built and how we connect with each other, know how to connect with each other. My dear friend Tony Estevez, he's just launching a book called Talk to More People just yesterday, and it's all about how to make connections with strangers. How do you reach out? He met one person for a year, and he actually met about 550 people in that process. So learning how to reach out to other people is a part of it. But I want to say as well that one thing that Johann Hari talked about is he knows now that when he feels depressed, he doesn't do things just for himself. He'll actually reach out and try to help someone else, because research has shown that our connection with others and our ability to connect and actually give to others can help. So I just want to make sure that viewpoint is within that conversation, the viewpoint of community building and how we are connected to others, instead of it being this individual problem that I need to find more strategies to figure my mental health out with.
Very good point.
I want to make sure that that's there, and I think there's also an opportunity to present that format of vulnerability and sharing in how you present the town hall and how you present the work. And I think you're doing beautiful work, and it's so important. And I'd be very happy to support you in that, in however, whatever that looks like.
I really appreciate that, Eiley. I know I'm going to be reaching out to you again once we get into the festival development. The arts and culture stuff is again, as you know, the most exciting piece for me, but it's going to take a lot of time for us to really have some robust conversations about, because like you say, It's going to get easy to be distracted through the narrative that I just need to figure this out, or I just need to learn this concept, and that's going to make everything okay. And we really want to avoid that, because they're never going to walk out of there okay. That's not fair. They're not being set up for success. It's like you say, that actually just working together on something, anything, so that you can both feel okay, and then challenge yourselves to validate that for yourself, and to go, no, really, we're having a good time. This is something that we're enjoying. For example, one of the pieces in the about halfway through in the narrative journey is, again, that celebrating the god and the goddess, which is this big community mural where everybody gets to actually put down some of the things that they learned, which then stays with the city for the rest of that year, that we get to then just add on to, and it ends up being this giant mural of hope for how we can improve mental health literacy in Calgary and around the world, right?
Oh.
Very exciting stuff. But yeah, I appreciate you, Eiley. Thank you so much for speaking up today. And my board, thank you, Delapo, Stephanie, and Yamile, for being here. You guys are phenomenal. And back to, I was going to say, Elise, let's hand back over to you for some partner announcements. I know that there's upcoming stuff that we'll talk about in November from the Canadian Association for Mental Health, as well as our other partners. They're just still in development right now. So we'll make sure that we do a community roundtable in November as well. But yeah, I'll hand it back to you, Elise.
Awesome. Thanks, Stacy. Hello, everybody. I've met a few of you, and for others of you who I haven't met, my name's Elise, and I work with Alberta Social Innovation Connect, Absi Connect. And I was just going to do a little bit of a blurb on who we are and what we do, and another of our upcoming events. So let's see. Oh, I have to share my screen first. There we go. All right, so Absi Connect, this is our logo. You can, when you see this logo now, you'll know who it is. So we are a group of organizations and individuals from across the province of Alberta who seek to find, connect, celebrate, and support Albertans who are creating and testing new ways of approaching society's most pressing problems. It's a very wordy statement. There's a lot to what we do, and it's also very ambiguous work, as most social innovation work is. But yeah, we amplify the voices and the stories of what's going on across the province, of changemakers, social innovators, all of that good stuff. And I broke it down into the how we do this part. I'm a tangible person. I always need something to hold on to, and the last sentence is very ambiguous. So these are the main ways of the work that we do. We do intentional connection through webinars such as this, online convenings. We have a Network Weaver group. They gather once a month for a call to chat about what they're doing in their own work, as well as to have conversations around the larger conversations, I guess, that we see happening in the province, Canada, worldwide. Local and regional workshop gatherings that are on hold because of COVID. The Community Catalyst program, to which Eiley is actually a part of our Community Catalyst program. This is our first launch of this past year. It's coming to a close at the end of October, which is really sad. We have an online resource library that highlights key terms of social innovation, so the definitions of them, examples of those terms. So let's say like social enterprises, we have lists of different social enterprises across Alberta and Canada that are doing the work well. Co-host and attend events, promote meetups and events as relevant, and connect with other networks who are doing similar work to us. So that's the connection piece. The sharing stories and evidence, we have a podcast. It is called Pause. You can find it on any podcast platform, the majority of them. We're on Apple Podcasts, Spotify, Stitcher, and Google Music. That is now changing names, and I can't think of what the new name is. But yeah, our podcast, we've finished 2 seasons. Third one's coming up soon. We share monthly blog posts as well. We have a monthly newsletter. You can sign up on our website, social media platforms, and again, resource library. So if anybody's interested in being a guest on the podcast, if you have some thoughts brewing in your mind and you want to bang out a blog post, we're happy to share it. As well as if you have any resources or events that you know of in the network that you want to be shared out across the network, you can feel free to reach out to me. We'll pop it in our newsletter as well as social media. And the last main thing that we do are identifying pattern, gaps, and opportunities across the province. So this work is ongoing now. It's fairly new. We just started doing some of this patterns, gaps, and opportunity sharing. Just started, beginning of this year, and hopefully we'll have some findings from that soon. So that's kind of the tangible pieces of what we do. And another event that you can attend that we're hosting is October 22nd. So it's from the Stanford D School. They have a starter kit, and essentially it is a workshop package that they have created that then you can get from them and present to your own group. So it's kind of, they've put it all together and they said, here's the information, the videos, the processes, all of that. Share it out with your network or with a group of your choosing. So we have, in partnership with University of Lethbridge, somebody there who is going to be presenting this workshop series, and it's all around design thinking, which is actually really relevant to the town hall because the town hall is going to be all design thinking. So if you want some intro deep dive into learning how the design thinking process happens beforehand, feel free to join us. So it'll go through design thinking processes and methods, capabilities, and at the end, hopefully you'll come take away from it how you can apply human-centered design to your own work. So yeah, that's our upcoming event. The link for it is down here, which I will also pop in the chat if anybody's interested in registering. Stop my screen share. So yeah, that's about Absi. There we go. I lost you guys for a second. That is Absi Connect, and as always, we're always accepting new people into the network. It's never a closed network. So join our newsletter. You can hear about what's going on in the province. If you want to be a part of one of our larger groups, such as the Network Weaver community, they gather once a month. Let me know. I can share much more information on all of these. I just wanted to do a quick surface level intro. But yeah, if you want a deeper dive, I'm here to do that. Mm-hmm.
Very much appreciated, Elise. I know there's a lot of resources, even just in your resource section on the website alone for social innovation. And I know that it touches on many different aspects of society, not just health, but from, I was going to say, can you speak to a couple other different aspects outside of there's health innovation? Is it economic development, any type of, some of the projects you guys are really excited about?
You know what, I can even just show our resource library. So part of what we do, we don't necessarily, or a lot of what we do isn't reinventing the wheel, it's sharing the wheel that's already going around. And so, this is our website. If you want to sign up for a newsletter, it's on the homepage. You can scroll down to the bottom here. But yeah, we have this handy dandy resource library, and it talks about the main social innovation principles that we would get asked quite often. People would send us emails being like, oh, do you know somebody who's doing really great developmental evaluation that we can connect with? And we're like, yeah, we know a lot of people. And we kept finding that we kept getting that question of, can you connect me with so-and-so or so-and-so? And this gives a bit of an overview of who's doing this work in the province. So we've got developmental evaluation, human-centered design, Indigenous innovation, social enterprise, social finance, social innovation in corporate and public sectors, social innovation labs, social procurement, social research and development. There's a lot of socials in here, and systems thinking. So within each one, if you click learn more, it just does a breakdown of definition. Here's some resources to learn more about this process. And then this one has a lot of resources. And then we also have Alberta examples. So these are kind of who's who, a little bit of a who's who in the zoo. There's obviously so many people across Alberta who are doing each one of these areas of work, but we just wanted to give a quick snapshot. And then as well as outside of Alberta examples.
Huge.
Yeah, that would be the resource library. I'm not sure if I fully answered your question, Stacey. I kind of took it off on a different area.
No, but that was the perfect tangent, because I was like, there is so much more to that statement that is just beyond what you just said. And I think that with the work that's been happening, like you say, across the province, that you guys are getting more calls for that type of work and for that type of resource is heartening to hear. Absolutely.
Yeah, definitely. So, and if you know of anybody who should be added to those lists, also send them my way, and I'm happy to add them.
Sure, will do. Well, I think that wraps us up here at about 12:56, but I think we are at a healthy, rounded conversation. One last final thank you to everybody that's attended today. and to Elise for hosting this from ABSI Connect. And I know that we will be sending out a copy of the recording to all attendees, and all of the links that we've talked about. We'll have a follow-up formal email for you as well. All right.
Sounds great. Thanks again, everybody, and enjoy your Thursday.
Take care. Have a good one, guys.
See you.